Welcome. My name is Cari Clark, and I'm going to be speaking about intimate partner violence, other family violence, and women's unmet need for family planning in Jordan. We know that intimate partner violence is related to unmet need for family planning in the broader literature. We also know that women who experience intimate partner violence in a number of regions of the world are also at risk of experiencing violence from other family members. So the research question behind this particular study is really, how does intimate partner violence and family violence exposure influence Jordanian women's exposure or risk of unmet need for family planning? This particular study is a secondary data analysis of the 2012 Jordanian Demographic and Health Survey, and we've restricted our analysis to currently married women. For our measures, we're using a measure of physical or sexual violence as an indicator of IPV, and for family violence was measured as being hit, slapped, kicked, or otherwise subjected to some other form of physical violence since the age of 15. An unmet need for limiting or spacing was measured using the revised method. We used logistic regression to examine whether intimate partner violence was related to unmet need for family planning, and then we stratified the models to look for effect modification by exposure to other forms of family violence. In this particular sample, the mean age at marriage was approximately 21. And in Jordan, there's a high proportion of women who receive at least a secondary education. A small percentage of the women were in polygamous relationships. And on average, approximately 4 children had been born to each woman. Most women participate in at least one of the major family decisions that was being asked, and unmet need in this particular population is relatively low at 13%. Overall, the vast majority of women did not report exposure to violence. About 22% reported exposure to intimate partner violence, 16% reported exposure to any other family violence, and about 6% reported exposure to both. In our regression analyses, we found that intimate partner violence survivors had a 73% higher odds of having an unmet need for contraception, controlling for the variables that you see on the screen. When we stratified our analyses and also tested for an interaction, we see that those who are exposed to both forms of violence have a much higher odds of experiencing unmet need for family planning than those who are exposed only to intimate partner violence. And it's about 2 times the odds. So in conclusion, we are supporting the broader literature in that intimate partner violence is related to unmet need for family planning, and that those who experience both are especially at risk, and perhaps doing a better job with examining the broader range of familial violence experience that women may be exposed to might help us to identify those who are most at risk. Next steps for this particular study are to use these findings and in collection with those of my broader line of research, and to develop innovative interventions to improve women's reproductive health in Jordan and to reduce the likelihood that she will experience family violence. Thank you.